All right, morning everybody. Thanks for coming and hearing a little bit more about the Affordable Care Act. It's kind of a big deal. We have the opportunity for the first time in 100 years to make sure that everyone in this country has access to at least some form of affordable coverage. So Citizen Action, we're an issue-based group that's been around for 30 years in Wisconsin. We work on a number of issues like economic development and voter protection, but we also, our biggest one is on healthcare reform. Been working on it for a lot longer than this law's been around. So we thought it was appropriate for us to talk about not only what's in the law, but how to make it better. Because the Affordable Care Act is just now the floor. States can go above and beyond now. They can say that this is now the new reality in Wisconsin. And to put it in perspective, Utah is going to make it so there are a lot of private options to choose from, close to over 80 actually. Some may say that's great, others may say that's a lot. And so other states like Vermont will now have single-payer health insurance because of this law. And so we can see which one is a better option. But really the states now decide where to go. So that's what we've been working on now. So the Affordable Care Act, our argument is it makes healthcare more secure and returns control to consumers. Really quick reminder that we can't really go back at all. This is the reality, in case you guys weren't familiar, is before the Affordable Care Act, it was legal for insurance companies to deny coverage to children with cancer and other pre-existing conditions. Starting in 2014, it will be illegal for all insurance companies to deny people with cancer and cancer survivors starting January 1st. And also on January 1st, it will be illegal for insurance companies to charge higher rates or deny coverage to anybody with any pre-existing condition, be it cancer, diabetes, arthritis, high blood pressure, so on. So a little quick thing about why we talk about healthcare. We understand healthcare policy can be kind of complicated. Not everyone really wants to get into the nuts and bolts of it. And so we try to explain it in a way that people kind of get at a gut level of why this is important. And so we talk about the values that we think most Americans believe, and we certainly do. And the first is freedom. We personally believe that every American should have the freedom to control their own medical decisions without interference from insurance companies or government or wherever. They and their medical professional should choose what's best for them. The other one is opportunity. Americans who lack access to stable, affordable coverage, they don't have the same opportunity or the same fair shot at the American dream that you and I have if you're constantly worrying about a healthcare disaster becoming a financial one. And we believe that every American should have the opportunity to change jobs or start a small business without fear of how they're going to get healthcare. Because I know most of you probably have met someone who says, you know what, I hate my job, but at least I have health care. Or I'd love to go off and start my own company. How the heck am I going to get health insurance? This law is made to fix this. And last one is responsibility. And we understand that the majority of the reason that people don't have health insurance is not that they don't want it, it's that they can't get it. Problems with access, problems with affordability. And so this law says, you know what, we're going to address this now and in the future, but you have to do your part now that it's affordable and accessible to you and actually get it. And I think people want that. I think people want that security of knowing that when they get sick and injured, they have something for them. And so that's what this law does. And it also recognizes that insurance industry, it's not going anywhere. And they should be allowed to make a reasonable profit, but they should do so by selling better business practices, better plans at better prices to more people. Not by deciding who's worth insuring and who's not worth insuring, all these horror stories that we've heard about over the years. Okay, so the Affordable Care Act, it's our belief that it actually does positively impact these values. Passed March 23rd, 2010, 3.5 years old already, hard to believe. And it comes in two stages. Some of it is right now, but a large part of it is going to be happening in a few short days. But first, the reason we're talking about this at all is because it's constitutional. And that was me when the law passed. So our argument is it's the law of the land. We've just spent 3.5 years debating whether it's constitutional, whether it should pass, whether it should be allowed to remain. We've had a whole election around it. Let's get to the job of making it work. Let's get to the job of figuring out how do we get more people covered. Because there's, I believe it was 20,000 here in Racine County are people who are going to need help enrolling in health insurance. And that's what we should be putting our focus on, not the politics of it, but actually making it work. Because for the first time, everyone will have some place to go to get affordable coverage. All right, so really, really broad strokes, what's now and what's later. In effect right now is the Affordable Care Act outlaws some of the worst health insurance abuses, such as denials based on pre-existing conditions for kids. It also requires more accountability from insurance companies, like using your premium dollars on actual health care. Starting January 1st, 2014, only a very short amount of time from now, guarantees every American has a place to go to get quality, affordable coverage. And it will permanently outlaw health insurance industry discrimination. And my personal favorite is it requires members of Congress to get the same plans offered to us, them and their staff. Anything Paul Ryan or Gwen Moore can get, I can get, and vice versa. Okay, so stage one, this is in place right now. The Affordable Care Act holds insurance companies and government responsible for preventive care coverage and screenings with no copays and no deductibles. Really, there's no more excuses to not get checked up to make sure you don't have something more serious. Because this includes things like mammograms, colonoscopies, flu shots, doctor's visits, pregnancy screenings, cancer screenings, depression screenings, STD screenings, a whole gambit. You now can go without worry about having to pay a copay or deductible to make sure that you're healthy. Because frankly, this is what we should be encouraging. This is a huge shift in American history. In the past, it used to be, we used to wait until you were so sick you needed care. Now we're saying, let's make sure you're healthy the first time around. Because the vast majority of healthcare costs in this country are by a few very sick people. How do you fix that? You make sure they don't get very sick. You find cancer before you need chemotherapy. You address the diabetes before you have to worry about the consequences. We have to make sure people are healthy the first time around. Now, this is not a panacea, but this is going to really help healthcare costs and our health in the long term. Young adults can now stay on their parents' policy until the age of 26. I'll get to that in a second. And preventive care without cost sharing for seniors on Medicare. And I say that separately only because people on Medicare have had it for a full year longer than anybody else. Okay, because of healthcare reform, 6 million, and that's arguably a low number, young adults are now covered on their parents' policy. Now, part of it is because, we're young and invincible millennials. I like to say we, like I'm one of them still. I may not be. But when polled, healthcare is like number 31 on the list of things they care about. But that's only part of it. The other part of it is entry-level jobs nowadays, they don't offer the same benefit level they did 10, 20, 30 years ago. And so I've met plenty of parents, mothers especially, who are very glad that when their child is going off into the workforce, they at least have this guarantee, this assurance that they can get some form of care, even if their new job doesn't offer it. Okay, so more things that are in place right now. The insurance industry violations of what we call healthcare freedom, the ability to control your healthcare, that we've probably heard about. We've heard horror stories. They've made movies about these. But pre-existing condition exclusions for kids. Right now that means today, every child with diabetes, with autism, with cancer can't be charged more, can't be denied insurance, can't be dropped from their insurance. That's right now. And next year, that's all of us. Lifetime limits, if you're familiar with this term, it's a maximum dollar amount that your insurance plan will pay out over your lifetime. And it's usually like $1 million or maybe $2 million, which is really not that much when it comes to healthcare costs. In fact, this is the number 2 reason the American Cancer Society supports this law, because people with cancer hit that pretty frequently. Too frequently, unfortunately. And so here's the problem. When you've hit that amount, when you've hit that lifetime limit, you're now off your plan. Chances are you have doctor's bills piling up, and you probably now have a pre-existing condition. Good luck getting insurance anywhere else. Lifetime limits are the leading cause of medical bankruptcy in this country. And medical bankruptcy overall is the leading cause of bankruptcy, is because of medical conditions. So just by addressing this part, we've gone a long way to helping this issue. Dropping coverage after a person gets sick. Why do we have insurance in the first place if you're doing everything right and you get penalized for it anyway? And also excessive insurance industry profits and overhead are capped. Right now, insurance companies must spend 80 to 85% of all premium dollars that come in on actual health care. Not profits, not overhead, not paperwork, not fancy offices, not administrative costs, not CEO compensations, not insurance agent commissions. Actual health care. And if they don't, they have to send you a rebate at the end of the year or reduce your premiums in the future. And so the first year that this came about, in Wisconsin, $16 million came back to Wisconsin consumers by their insurance company that was overcharging them. Last year, it was only 3.5, which means insurance companies have already figured out how to be much more efficient with the money we're already giving them, which is the first step to fixing the healthcare problem. So as I mentioned, we've traveled all over the place talking about the law, and we've met a lot of individuals who've been personally impacted and can probably talk to this much better than I. So I'm going to share Tracy's son, Sammy's story from Appleton. My 7-year-old son, Sammy, suffers from a disease that causes tumors to grow all over his body. The condition is called neurofibromatosis. Sammy's treatment cannot continue if we hit our insurance policy's lifetime limit, that maximum dollar amount. Thanks to the Affordable Care Act, insurance companies can no longer impose lifetime limits or deny coverage to children like Sammy with pre-existing conditions. We can't go back to being on our own against the insurance companies. Fun fact about Sammy, he was going to hit his lifetime limit by the age of 10 because of a genetic pre-existing condition through no fault of his own. But now, Sammy will be able to make it to adulthood without worry of healthcare concerns. By the time he is, this will be true for everybody, not just children. So I keep using this term pre-existing conditions. I just want to quickly say what that means. The Affordable Care Act ends health insurance industry assault, as we call it, on this idea that you should be able to control your health care for about 1.3 million of us under 65, or about 1 out of 4 people, because these 1.3 million people have already been diagnosed with some form of pre-existing condition, which is basically a bureaucratic nonsense word that means you have been sick or injured, you are sick or injured, you have a history of being sick or injured, or you have a propensity of possibly being so in the future. And because of which, this can lead to denials of rates, or denials of coverage, or higher rates. But a lot of people, especially this 1.3 million, don't know that because they have maybe employer coverage, or spousal coverage, or BadgerCare. But if they ever left their job, got laid off, went to go start their own company, or for some other reason lost that health insurance, and they went to get it on their own, they would learn the hard way that this can lead to discrimination because of their health history. And frankly, the older we get, the more likely we're going to get one. Very few people leave life alive. 55 to 64, that age group, 55 to 64, just over half the population already has a diagnosed pre-existing condition. Because this is what they mean. Every one of these are pre-existing healthcare conditions. Anybody know anybody with any of these? A couple of us? Yeah. My personal favorite are acne and pregnancy. Does that run in anybody's family? A couple of us? Yes. And by the way, if you are concerned about a particular condition and it's not listed on there, it's not because it doesn't count, it's because I ran out of space on the slide. Here's the thing, before the law passed, there really was no entity who said, this is the master list of what is pre-existing and what is not. It was frankly up to the insurance company to decide that. And so now there is. None of them can be, starting on January 1st, and right now that's the case for children. I should also mention, if you happen to know a woman, you can raise your hand, because we have been systematically charging them more for health insurance for years. Women, when it comes to insurance, their actuarial term is they're riskier than men. And what that means is that women use benefits more often. They go to the doctor more often. They try to make themselves healthier by being more responsible. And they also tend to get pregnant more. And because of that, to an insurance company, they cost more on average than men of their age group. And so because of which, insurance companies make up the difference by charging women more. And it's not a little amount. A 22-year-old female pays on average 1.5 times what a 22-year-old male pays, about 50% more. And that has nothing to do with their individual life choices. They'll get you there too, but you could never get sick, never get pregnant, never go to the doctor, and you will still pay more than your male counterpart. But not in 2014. This ends on January 1st. So finally, being female will no longer be considered a pre-existing condition when it comes to health insurance. Okay, so how do we fix this? This is clearly a pretty pervasive issue. We have to address this. Costs in this country have skyrocketed. In Wisconsin, health insurance costs have doubled in the last 10 years. 200% increases. That's faster than that's faster than the growth of wages of businesses, faster than the growth of profits, faster than the growth of taxes. So this issue of health insurance costs and access and affordability has been squeezing our families, our businesses, and our local and state governments. So we have to address this, and here's how we're going to do it. Guaranteed affordable care in 2014 that can never be taken away. Health care coverage guaranteed to everyone who buys insurance on their own or through a small business nonprofit in the use of a new consumer-friendly competitive marketplace or just the marketplace. This marketplace for the middle class, basically, if you've ever been to Travelocity or Expedia or Kayak, you know what a marketplace is. It's an online hub where you can go and see all of your options. Companies have to come to you as opposed to the other way around, and you can really leverage consumer buying power to really get a better deal. And this will be open to all Americans who do not have affordable coverage options now or in the future. And this in the future part's very important, because if you like the coverage you have, if you have employer coverage or BadgerCare or Medicare or your spouse, or you buy insurance on your own and you like it, you can keep it. But if you ever lost that, if you ever got laid off or any of those other reasons for losing insurance, you will now have a place to go. You don't have to rely on things like COBRA. You don't have to go with periods of uninsured. You can immediately get another plan. And each state is going to have this marketplace. unless they choose not to, like Wisconsin has, and in which case the federal government will come in and do it for us. So either way, October 1st, this new marketplace will be up. And this will really put consumers in control with clear information and real comparisons. You'll really be able to tell how different insurance companies' plans compare to each other because they have to make it easy for people to understand. They have to rate them in a precious metal system. So a bronze plan from one company is very similar as a bronze plan from another company, and you can really compare them that way. And it's bronze, silver, gold, and platinum. Platinum, of course, being the highest cost, highest benefit. Bronze being pretty good benefit, but lowest cost. And so that's kind of how they compare the difference, but you'll be able to really see now what the options are. And also, members of Congress will have the same options we have. They also have to go to this marketplace, them and their staff. All right, so what happens if you go to this marketplace? Coverage will be more secure because it bans denials of coverage due to pre-existing conditions. No insurance company can deny you for them, and they can never drop you when you get sick. It'll make coverage more affordable by providing a premium tax credit on a sliding scale. So basically, no matter what your income is, you'll be able to get some form of insurance that is affordable and no more than 1% of your income. And even if you're lower income or moderate income, if you make less than $94,000 as a family of 4 or about $48,000 as an individual, you can qualify for a tax credit to bring down the cost pretty substantially to make sure that whether you make $12,000, $22,000, or $122,000, insurance will never be out of your reach, no matter what. On top of that, there'll be new options, such as a nonprofit, member-owned health insurance cooperative. Here in Racine County, you will have an insurance co-op option. And what that means is when you pay your premiums, you now can vote on the board of directors because you are a member, and all the profits go to keeping the rates lower. That's what insurance companies have to compete with now. It's called the Common Ground Healthcare Cooperative, and it'll start here October 1st. It's like credit unions in the banking sector. If you don't like banks, go to a credit union. If you don't like insurance companies, go to a co-op. Good opportunity, and this is what they have to compete with. And lastly, no discriminatory pricing based on medical condition and gender, those things I went over, and age as well. Right now, a 22-year-old may pay five times less what a 60-year-old will pay, or a 60-year-old pays 5 times more, and that's about average. Now that's reducing it. It's not flat across the board, but it's a lot less than it is now. It can never be more than 3 times more than what a 20-year-old pays. Now that's maximum. It could be less than that, but it's still way better than it is now. So these are the important dates to know. If you leave here with little else, keep this in mind. October 1st, 11 days from today, this new marketplace will be live. You can see plans, see what you want, compare your options, find out your tax credit, even if you don't intend to buy. If you like the coverage you have, but you just want to see what else is out there, check it out after October 1st. January 1st is when these new plans kick in. Anything you get October 1st or afterwards starts after January 1st. New calendar year. And March 31st is the end of open enrollment. There is an open enrollment period. They're trying to make sure people go from October 1st to March 31st. And the reason for that is if I said you should get coverage, but get it whenever, you really don't have that push to do it. This way they're trying to make sure people go during this 6-month period. They're not waiting to get coverage until after they need it. They're not trying to get home insurance until after the house is on fire. They're trying to get it earlier on. Now, you can still go after March 31st, but it's really specifically for people who have different qualifying events in their life. And that means things like changes of income, moving, getting married, having a child, losing a job, losing insurance. If any of those happen, yeah, you can go back to this marketplace anytime, even if it's July or August or wherever. But if you're just buying insurance for the first time, we really recommend you go before the 31st of March to make sure that you have some option for you. All right, where can you go? Well, here, for example, the public library will be helping make sure people understand their options. But basically, anywhere that there is a computer with internet access, you can go online to healthcare.gov. That is the new marketplace, and weigh your options after October 1st. But if you don't like websites, we understand not everyone feels comfortable sharing their information from them. They can also use a 1-800 number that's live 24/7. You actually can do it over the mail too, but it's probably the least common. Again, public libraries. Many nonprofits will be licensed as what they call navigators, which are just entities to help enroll people. Think of them like insurance agents that don't get paid commission. They're really just there to help show you your options. Additionally, local institutions like hospitals, community health centers, free clinics, or other groups will help enroll individuals. They'll get licensed to really walk people through it. And lastly, brokers and agents. A lot of people like their relationship with their broker and their agent, and frankly, it's sort of a new world for them. Because before it was sort of a sales thing, figuring out who's worth selling to, figuring out what kind of plan they can buy. Now it's an enrolling thing. You got to find people, bring them into the door, and that's a brand new world for them. And it's a good thing. But you can still go to them. I myself got an insurance license just to understand this world a little bit better. Okay, quick thing about employers. So some of us have heard that there's a requirement for large employers to offer some basic level of benefits. That has actually been delayed until 2015. It was originally going to be this year. So employers, even large employers, are not required to offer some form of health insurance. But obviously many employers do. So that's not going to change. They're still going to offer some. But they're not going to be penalized for not doing so until a year from January 1st. In fact, some small businesses will have the option of tax credits to offer to cover their employees, to help them do it. And you may, as an employee, use this marketplace. But if your employer, you can go there even if your employer offers you something. But if your employer offers you pretty decent coverage, not shoddy, not like really expensive or very poor insurance, but if they offer you pretty decent insurance, you can go to the marketplace, but you'll have to pay it out of pocket. You won't be getting a tax credit because you have coverage. But if you want something better, that's your prerogative. You just won't get a tax credit to do it. So it really maximizes choice, but it emphasizes making sure everyone has at least something. Something that's better, that's good for now. The average plan in the new marketplace has been rated better than the average plans that we have now. They'll offer new benefits they traditionally don't now. All insurance companies have to cover preventive care. They have to cover things like ambulance rides and mental health coverage and substance abuse coverage and a whole range of what they call essential health benefits that frankly they don't have to offer now. All plans will soon, so we'll be having better options in front of us. All right, so I want to share a really quick story with you. This one's a little bit more of a business-related one. Remy's story from Pepin, Wisconsin. It's a southwest of Eau Claire, right along the border. I own a small cafe. Over 20 years ago, I beat cancer. But ever since then, no insurance company would sell me a policy because my cancer is called a pre-existing condition. Starting in 2014, the Affordable Care Act, no insurance company will be allowed to discriminate against me because I'm a cancer survivor. Now, this story, the reason I bring this up is it continues. Not only is, well, personally, I think that if you fought cancer, you don't have to fight your insurance too. But outside of that, for anybody who's gotten small group insurance for individuals or nonprofits, you're charged more based on the health, gender, and age of your employees. So if you have older, female, or sicker employees, then you're going to pay more as a small group nonprofit. And so in her situation, because of her health history, she was priced out of offering insurance to not just herself, but her 6 employees too. So now it's not just one person taken away from the market, now it's 7. And so here you see the problem. Because the way health insurance is supposed to work is that we have a big pool of money, a risk pool, a big pot that all of us put premiums into. And then claims come out, occasionally when people get sick. And the theory behind it is that we're not all going to get sick and injured at the same time. So at any given moment, there's enough money in the pot for us to take care of it. They're called, again, risk pools. That's why large employers, Harley-Davidson, Marquette University, the state of Wisconsin, they have so many people paying into this. They spread the risk out so far that they're not all going to get sick and injured at the same time, so they don't even ask you what your health history is. And they offer better rates than a smaller group would. But that's not where we've been going in American healthcare, and especially not for small group and small businesses. What we've been doing instead is saying, we'll cover you, we won't cover you, we'll cover you, but we'll have to make you pay more, maybe even too much for you to even want to buy it. And so this risk pool is getting smaller and smaller as fewer people are putting money into it, meaning that we are paying more and more every single year for either the same or worse level of benefits. If you've ever been in a job where you've seen 10, 20, 30% increases a year for the same benefits, or you constantly have to talk to your agent about, well, what can I tweak to make this better? Maybe a little higher deductible, maybe a little worse copay plan, then you're familiar with this. But this is where we've been going because we've been narrowing where we put this. But that's the opposite of what we should be doing. We should be broadening it, making sure more people have access to care. People can put premiums even if they have a pre-existing condition. So this risk is so wide, this pot of money is so wide that we're all paying less even if you have a pre-existing condition, even if you're female or older. And that's how healthcare works, and that's why national healthcare programs pay less on average and do not ask those questions. They want to make sure everyone's covered. That's how it works. Okay, I want to quickly talk about BadgerCare because this is sort of an important issue that's been brought up a lot in Wisconsin's contentious issue, and I want to make sure you guys understood what happened, what was supposed to happen, and what's moving forward because it's not really a done issue yet. So the backstory is Medicaid is a state-federal partnership that goes into a lot of things like long-term care and covering low-income, moderate-income people to offer some form of health insurance. It also goes into some sorts of prescription drug plans like senior care. What we in Wisconsin did, we said we can make it better, and so we created BadgerCare, which offers better level of benefits to more people, but because of which we had a tiered program. Do you have a child? Are you a child? Are you pregnant with a child? Or are you childless? There's different eligibility, there's different options, there's different benefits. And so because of this, there were a lot of holes in the system. About 157,000 people were on a waiting list for the program before the law passed. The Affordable Care Act said, look, we understand that even with all the changes to insurance, even if you make it more competitive, more transparent, give tax credits, and reduce discrimination, there still will be a subset of the population that just cannot afford it. We understand that. So they put plenty of federal dollars, billions in fact, and give it to Wisconsin and said, look, we'll fix your BadgerCare program, end the waiting list, cover more people, so that no matter what, you'll have access to some form of health insurance. And the minute you are $1 over that, you can affordably go to this marketplace and get some form of private insurance. It was going to be seamless transition. But the Supreme Court, when they looked at the Affordable Care Act, they upheld the entire law with one exception, and that was this piece. They now said states can choose whether or not to take it. That was never an option to begin with. And so the governor announced in February that they were going to reject the funds, and that was reiterated in the state budget that passed at the end of spring. And using the state of Wisconsin's own numbers from the Legislative Fiscal Bureau, which I cited here at UW Population Health Study and the Wisconsin Public Radio News, Walker's approach will cost the state about $149 million more this budget alone to cover fewer people, but it also kicks 92,000 people off. Now here's why. People who don't have coverage, they don't suddenly stop racking up healthcare bills. They go to emergency rooms, or they go to county mental health centers, or other forms of public assistance. And so because of that, we all pay. Hospitals, if someone comes in unable to pay, they push the cost onto those with coverage. We've all heard of the $80 aspirin story. And so because they're businesses at the end of the day too, it's estimated that the average family pays $1,000 extra per year to help cover the cost of the uninsured. And so it's actually in our interest to make sure more people are covered because it reduces how much we end up paying when it's our turn to have to pay. So the good news about this BadgerCare issue, the Affordable Care Act, because of its marketplace, will allow these people to have some access to coverage they may not have had without BadgerCare. However, the bad news is that when the law passed, everyone assumed that people of this narrow income limit, just over the federal poverty line, really wouldn't have access. They wouldn't really be able to afford these new insurance options. That's why they said that they would be able to go on BadgerCare. And so with this not an option, yes, they can still go to the marketplace, but we can't guarantee it's affordable. Someone making $12,000 a year, suddenly a $2,000 deductible doesn't look that affordable to them anymore. And so there's a good estimation that a lot of these people are not going to purchase insurance at all or keep it going throughout the year. But the good news is that Wisconsin can take these federal dollars at any time. Tomorrow, next month, next budget, or next governor if you want. And so this is going to happen. It's our argument. It's too good for the state. It's too good for the state's citizens. Too many organizations have spoken up about this. Everyone from the Milwaukee Association of Commerce to the Wisconsin Hospital Association, Wisconsin Medical Society, 15 county governments have voted for it. Lutheran Center for Public Policy, the Catholic Conference, the Jewish Federation, huge lists of organizations have called for this to make this happen. We have a list of 240 on our website. So it will happen. The only question is how long we have to wait until it does. And so toward that end, actually, starting on Monday, those individuals who are going to be taken off of BadgerCare, the 92,000, and that might even be low, are going to receive a letter in the mail telling them this. But we just found this letter. We just got access to it, and apparently it's not that descriptive. It just says, attention resident, someone in your house may be kicked off BadgerCare. You'll find out more in December. It doesn't say who. It doesn't really tell them where to go. If you have any questions, call the state. doesn't tell them to go to the county, doesn't tell them to go to healthcare.gov, and that's what people will start receiving next week. And I personally hope that they fix that, but based on we just saw it yesterday, it may not be the case. So there's going to be a lot of questions going around. Before you assume that this is a partisan issue, I want to list all the different conservative governors, or no friends of Obamacare any other day of the week, but they have called for taking these federal funds. And this one here, Tom Corbett from Pennsylvania, just this week announced they wanted to do it. So he was one that said no and then changed his mind. A lot of governors understand how important this issue is for the state and all that. So it's not as simple as a left versus right argument. You really got to understand the policy of it. Okay, my last story, Terry's story. I'm a personal care worker. I work at a group home and I make $9 an hour taking care of other people's health. Even though I take care of other people's health, I do not have affordable coverage options myself. I have not been able to qualify for BadgerCare. In fact, I'm just over number 141,000 on the waiting list. I'm a father of 3. I want to give my children their chance at the American dream, but without health insurance, we're looking at an uncertain future. The changes in Madison that have happened in the last state budget to BadgerCare mean that if you work 40 hours a week at minimum wage, you can no longer be on BadgerCare. It's no longer an option. So people like Terry, who oftentimes work for one of those more low-wage jobs that do not offer benefits, may be out of luck because they may not be guaranteed health insurance that is affordable like it should have been had we taken the full federal funding, and we still can do. Okay, so quick thing about Medicare. People used to ask a lot about this before the election, but since then it's really not that common. But what happens with Medicare is that it actually doesn't touch a dime of benefits to the people who are receiving it, but it does have some major administrative changes that I want to make sure are known. So the first off is the Affordable Care Act cracks down on waste, fraud, and abuse in Medicare. You may not believe this, but before this law passed, there really was no entity who went after waste, fraud, and abuse on a national scale, really looking into it. The FBI was supposed to, but they were never funded in any federal budget to do it. And so now, FBI and Health and Human Services have created the Task Force on Medicare Fraud, and the first year found about $6 billion in waste, fraud, and abuse. Now, this is mostly not from individuals. This is mostly from medical medical device manufacturers, suppliers, and some providers. And so now that money, fraudulently used or wastefully used, is now put right back into the system. It also ends handouts to insurance companies. A number of insurance companies provide Medicare additions that you can purchase that have been receiving public subsidy for a long time. But it turns out if you give public subsidy to a private company, what incentive do they have to be competitive? And so by not even taking away, but reducing how much federal subsidy these companies have gotten, they're now forced to be competitive. And now these companies have sold more plans to more seniors cheaper because of this competition that we know works. Also provides free preventive care to decrease costly emergency room visits and reduce healthcare costs long term, as well as actually ending the Medicare Part D donut hole over time because it's a situation where seniors have been paying a ton out of pocket for needed drugs, and it was a horrible loophole that really damaged a lot of people's pocketbooks. And so that'll be fixed because of this law moving forward. Oh, and people like to attack this law saying that it somehow cuts Medicare. This is actually how it does it. And I would argue that that's not a bad thing. So the next time someone says that it cuts money from Medicare, I challenge you to ask them how. And chances are they either can't answer or they're forced to respond with this, because it doesn't touch benefits for people. It just makes the program run much better. All right, so this is our argument. The Affordable Care Act is worth protecting. Insurance companies must now play fairly. It's the law. If you only have an elevator conversation to talk about this law, this is what I would suggest. The insurance companies must play fairly. It's the law. You finally have someone on your side against many of these insurance companies. Working families can no longer be denied coverage for pre-existing conditions. They'll never risk losing their coverage when they get sick, and they'll never hit a lifetime limit. Why? Because insurance companies must play fairly. Preventive care now must be covered free of charge by insurance companies, including mammograms for women, wellness visits for seniors, and checkups for children. Insurance companies must now play fairly. Why? Because millions of Americans will receive a rebate and already have received rebates because their insurance company spent too much of their premiums on administrative costs or CEO bonuses. And lastly, families will not be forced into bankruptcy when someone gets sick, and they'll be free to qualify for affordable coverage no matter where they choose to work, what gender they are, with no loopholes or fine print in the policy. Insurance companies have to write in 12-point font now. They literally thought of everything. So beginning January 1st, 2014, we will live in an America where everyone has the freedom to control their own healthcare decisions no matter what. So happy to answer any and all questions, but I will say, like healthcare reform, hate healthcare reform, at least go to healthcaregov on October 1st, at least see your options. You may like what you find.